When you arrive at our office and you've been trying for a year, or you go to your OBGYN and you've been trying for a year or 6 months, depending on your age, and you're not pregnant, some of the things that we're going to look at are going to involve both the female and the male partner. So on the male side, we always get a semen analysis to make sure there's sperm, to look at motility, to look at what they look like, or it's called morphology, and to determine whether these parameters are normal. At the same time, we're going to be evaluating the female partner. So we're looking at whether or not you're ovulating well. We want to see whether or not your baseline hormones are good, that we get on the second or third day. And then we also get a progesterone level usually after ovulation, about a week later, to determine if the quality of the egg that you're making is good enough to support a pregnancy. If all of those are good, then we also want to check your tubes. So we do this through a test called a hysterosalpingogram, or an HSG. This test is an X-ray test in which dye or contrast is injected into the uterine cavity. By doing this, we're able to see the outline of your uterine cavity to detect if it's normal or if there's polyps or fibroids or scar tissue inside. And the main reason for this test is to look at the tubes. We want to see if your tubes are open. With this test, as we push the dye out, we're able to see if the dye flows out through the tubes easily or whether there's a blockage. So does the dye stop before it gets into the tube? Does the dye stop at the end of the tube and form kind of large balloon-shaped tubes, which are called hydrosalpinx? If your tubes are blocked, this could be one of the reasons why you aren't getting pregnant. So this is something that needs to be resolved and further evaluated.